Hello, Christine. How are you doing?
Hello, Donna. I'm doing great.
Hey, now you're going to tell us and the audience a little bit about a meeting that you just participated on some of the latest research and discoveries in oncology and cancer. Could you tell us a little bit about what the conference was and the name of the conference?
Yes, well, the ASCO, or American Society of Clinical Oncology annual meeting was just completed. And at that meeting, they present thousands of studies and pick the best ones to present at the large meeting. The theme this year was actually advancing equitable cancer care through innovation. And so most of the presenters at some point would talk about what percentage of minorities were in their clinical trials, often very low percent, and the importance of diversity and eliminating barriers to people so that they may benefit from the advances in healthcare. It was a good meeting. We are talking about checkpoint inhibitors in lung cancer. So let's pretend that your immune system is a car and that the checkpoint is the brakes. And so the brakes are used to slow down the immune system. So if we had a runaway car or runaway immune system, it would destroy us because it would attack everything. The checkpoints prevent the cancer cells from being killed. So the checkpoint inhibitors gets rid of the brakes. So the T cells and the immune system are able to go back to what they were designed to do, and that is to kill cancer cells. At the beginning of my career, if someone with stage 3 lung cancer came to me and said, "Dr. Ince, how long do I have to live?" And, I didn't really like to put numbers, but I would say, well, on average, people with your cancer would do well 8 to 10 months. So fast forward 25, 30 years, we have these checkpoint inhibitors that have added tremendously to the treatment of lung cancer.
Is there a specific name for this particular study?
Okay, the Pacific trial, and they had this stage 3 lung cancer patients that were not operated on, and they were treated with traditional radiation and chemotherapy, and then followed by a year of one of those checkpoint inhibitors called Durvalumab. And it's given every 2 weeks through your veins for 1 year. And 5 years later, the 42% of patients were alive at the 5-year mark, which is just amazing for stage 3. We have patients with stage 3 and stage 4 that are living for years.
Tune in for more clinical chats with Dr. Donna Willis and Dr. Christine Ince. There's more to come from ASCO.